Good day everyone. Today I will presenting about the antimanic drugs, which are medication used to manage manic episodes and stabilize mood, particularly in the patient diagnosed with bipolar disorder. This presentation will discuss what antimanic drugs are, the symptoms of mania and the different classification of this medication and their mechanism of action. We will also highlight lithium, which is considered the gold standard treatment for the mania. Additionally, we will discuss nursing responsibilities, patient education, and electroconvulsive therapy or ECT as another treatment option. Antimanic drugs are the medication used to control manic episode and stabilize mood in individuals with bipolar disorder. Mania is characterized by extreme mood elevation, increased activity, and sometimes risk behavior. This medication help regulate abnormal brain activity and prevent extreme mood swings that can affect a person's daily function. Antimanic drugs are essential not only for treating acute manic episode but also for long-term maintenance therapy to prevent future episodes and maintain emotional stability. By the end of this presentation, the audience will be able to first, define antimanic drugs and their rules as mood stabilizer in treating bipolar disorder. Second, identify the common manifestation of mania that necessitate the use of this medication. And last, understand the different classification of antimanic drugs, including mood stabilizer, anticonvulsant, and atypical antipsychotic. Now, let's proceed. What is antimanic drugs? Antimanic drugs, also called mood stabilizer, are the medication that help control symptoms of mania and stabilize emotional states. These drugs work by balancing the level of neurotransmitters in the brain. Neurotransmitters are chemical messengers that play an important role in regulating mood behaviors and emotional response. By restoring these chemicals, balanced antimanic medication help reduce mood swings and improve emotional stability in the patient with bipolar disorder. Now, let's proceed to the overview of mania. Mania is a psychological condition characterized by abnormal elevated or irritable mood. Individuals experiencing mania often display excessive energy, rapid thought, and impaired judgment. This condition is commonly associated with bipolar disorder, where the patient alternates between manic episode and depressive episode. Mania can significantly interfere with a person's ability to function normally in social, occupational, and personal aspect of life. The common manifestation of mania. First is elevated or irritable mood. This means the person may feel extremely happy, overly excited, or unusually energetic. In some cases, instead of happiness, the person may become easily irritable or angry even with a small situation. Second, increased energy and activity. Patients with experienced mania often have excessive energy. They may become very active, constantly moving, talking a lot, or starting many activities at once without finishing them. Third, decreased needs for sleep. A person with mania may sleep very little but still feel energetic. For example, they may only sleep for 2 or 3 hours yet still feel fully awake and active. Next is rapid speech. Rapid speech means the person talks very quickly and continuously. It may be difficult for others to interrupt or understand them because their thoughts are moving very fast. Impulsive and risky behavior. People with mania may make poor decisions without thinking about consequences. For example, including reckless drives, spending large amounts of money, gambling, or engaging in unsafe activities. Now let's proceed to the indication of antimanic drugs. Antimanic drugs are used in several psychotic conditions, particularly those involving mood stability. Their primary role is to stabilize mood and prevent recurrence of manic episode. They are indicated for first, bipolar disorder. Antimanic drugs are mainly used to treat bipolar disorder, a mental health condition where the person experiences extreme mood swing between mania and depression. Next is acute manic episode. These medications are used to control severe manic symptoms when a patient is experiencing an active manic episode. Next is maintenance therapy. Antimanic drugs can also be used for long-term treatment to keep the patient mood stable and prevent future mood swing. Next is prevention of relapse. This medication help reduce the chance that manic symptoms will return after the treatment. And last, mood stabilization. This main goal of those medication is to maintain balance, emotions, and prevent extreme mood change. Now let's proceed to the classification of antimanic drugs. Antimanic drugs is classified into three main groups based on their mechanism of action and therapeutic use. First is the mood stabilizer. The medication is lithium carbonate. Lithium carbonate is the most commonly used antimanic drugs. It helps stabilize mood and reduce both manic and depressive episode in bipolar disorder. Next is the anticonvulsant medication. First is valproate. Valproate is originally used to treat seizure, but it also effective in controlling manic symptoms and stabilize mood. Next is carbazepine. Carbazepine is another anticonvulsant that helps manage mania by calming abnormal brain activities. And next, lamotrigine. Lamotrigine is mainly used for mood stabilization and particularly help in prevent depressive episode in bipolar disorder. Although these drugs are originally used for seizure disorder, they are also effective in stabilizing mood. And last, atypical antipsychotic drugs. First is olanzapine. Olanzapine helps control manic symptoms by affecting brain chemicals that regulate mood and behavior. And next, risperidone. Risperidone works by balancing neurotransmitter in the brain and often used to treat severe mania and psychotic symptoms. Lastly is quetiapine. Quetiapine is used to treat both manic depressive episode in bipolar disorder and help stabilize mood. Now, let's proceed to the lithium carbonate. Lithium carbonate is the most commonly used and most effective antimanic drugs. It is considered the gold standard treatment for bipolar disorder because of its proven ability to stabilize mood and prevent relapse of manic episode. Lithium works by influencing brain chemicals that regulate mood and behavior. Because of its effectiveness, it is frequently prescribed for both acute treatment and long-term maintenance for bipolar disorder. Now let's proceed to the mechanism of action. Lithium works by altering neurotransmitter activities in the central nervous system. It helps regulate the balance of chemicals responsible for mood, behavior, and emotional control. Lithium stabilizes mood by reducing excessive neurotral activity, altering sodium transport in nerve cells, and affecting neurotransmitter signaling. As the result of the lithium produce both antimanic and antidepressant effect, making it highly effective in treatment of bipolar disorder. Stabilize mood. Lithium helps prevent extreme mood change, keeping emotions and balance stable. Next is to reduce excessive neuronal activity. During mania, brain cells become overly active. Lithium helps calm this excessive brain activity. Next, alters sodium transport in nerve cells. Lithium affects how sodium moves in nerve cells, which influence how the signals are transmitted in the brain. And last, produce antimanic and antidepressant effect. Because of these drugs, lithium can reduce manic symptoms and also help manage depressive symptoms. Now, let's proceed to the therapeutic range of lithium. Lithium has a very narrow therapeutic range, which means the difference between safe dose and toxic dose is very small. For this reason, patients taking lithium required regular blood monitoring. The therapeutic blood level of lithium is usually 0.6 to 1.2 milliequivalent per liter. Blood samples are typically taken 8 to 12 hours after the last dose to ensure accurate measurement and safe medication management. Now let's proceed to the common side effect of lithium. Lithium may produce mild and manageable side effects, especially during early treatment. This effect usually improve over time as the body adjusts. Common side effects include fine hand tremor, fatigue, muscle weakness, mild nausea, increased thirst, and restlessness. Now let's proceed to the serious adverse effect. Although lithium is effective, it may cause serious adverse effect if not properly monitored. This effect required immediately medical attention. Serious adverse effects include severe tremor or strong shaking of the hands or body may indicate lithium toxicity. Next is confusion. Patient may experience difficulty thinking clearly or become disoriented. Next is arrhythmias. Lithium may affect heart rhythm, causing irregular heartbeat. Next is circulatory collapse. This is a severe condition where blood circulation becomes dangerously slow. Last is seizure. High lithium levels can cause seizure, which is medical emergency. Now let's proceed to the lithium toxicity. Lithium toxicity occurs when lithium levels in the blood become too high. This medical emergency can lead to severe complication. Early signs include coarse tremor, vomiting, diarrhea, drowsiness, and poor coordination. And severe toxicity may cause confusion, seizure, coma, and cardiac arrhythmias. Now let's proceed to the management of lithium toxicity. First is the IV administration of normal saline. Intravenous fluids may help dilute lithium in blood and promote its removal through the kidney. Next is the hemodialysis. In severe case, dialysis is used to remove lithium directly from the bloodstream. And next is osmotic diuretic. This medication increases urine production to help eliminate lithium from the body. And last, supportive medical care. Doctors monitor vital signs and provide treatment to stabilize the patient. Now, the nursing responsibilities. Nurse play a critical role in ensuring safe administration of lithium. Proper monitoring and assessment help prevent toxicity and complication. The important nursing responsibility include first, monitoring lithium in blood level. Nurse must regularly check lithium levels in the patient blood to ensure they stay within the safe therapeutic range. Next is assessing for the sign of toxicity. Nurse must watch for symptoms like tremor, confusion, vomiting, or weakness. Next is monitor fluid and electrolyte balance. Since the lithium affect sodium and water balance, nurse must monitor hydration and electrolyte level. Next is ensuring adequate hydration. Patients should drink enough fluid to prevent dehydration to reduce toxicity risk. And last, monitor kidney function. Because lithium is secured by the kidney, nurse must check kidney function regularly. Now let's proceed to the importance of nursing consideration. Lithium levels are affected by sodium and fluid balance. Any condition that decreases sodium levels can increase lithium toxicity. The risk factors including dehydration. Loss of body fluids can increase lithium concentrating in the blood and lead to toxicity. Next is vomiting. Vomiting can reduce sodium levels and increase the risk of lithium toxicity. Next is the diarrhea. Frequently, diarrhea may cause fluids and electrolyte balance. And last, excessive sweating. Sweating excessively can cause sodium loss, which increase lithium levels in the body. Because of this, healthcare providers must carefully monitor patient condition that may alter sodium balance. Some medication increase lithium level and may lead to toxicity. Nurses and healthcare providers must monitor patient closely. Example include thiazide diuretics. This drug increase lithium level by producing lithium excretion through the kidney. And last, potassium-sparing diuretics. This medication may also increase lithium levels and increase the risk of toxicity. Healthcare providers must carefully review the patient medication history, monitor lithium level when these drugs are used together. Now let's proceed to the patient teaching. Patient education is essential to ensure safe and effective treatment with lithium. Patients should be instructed to drink 2.5 to 3 liters of water daily. Adequate dehydration helps maintain normal lithium levels in the blood. Next is maintain normal salt intake. Sudden reduction in salt intake can increase lithium level and cause toxicity. Next is take lithium with food. Taking lithium with meals help reduce stomach irritation. And next, avoid dehydration. Patients should drink fluids regularly and avoid excessive sweating. And last, report usually symptoms immediately. Patients should immediately inform healthcare provider if they experiencing symptoms like severe tremor, confusion, vomiting, and diarrhea. Some cases, lithium may not be effective or may not suitable for certain patient. In this situation, other medication may be used to treat mania. These include anticonvulsants such as valproate and carbazepine, and atypical antipsychotics such as olanzapine, risperidone, and actopine. This medication also helps stabilize mood and reduce manic symptoms. In summary, antimanic drugs are essential in the treatment of bipolar disorder. They help stabilize mood, reduce manic symptoms, and prevent relapse. Lithium is a gold standard treatment but requires carefully monitoring due to its narrow therapeutic range. Nurses play an important role in monitoring patient education and prevent complication. Now let's proceed to the electroconvulsive therapy, or ECT. Is a non-pharmacologic treatment used in severe treatment-resistant cases of mania. This procedure involves the controlled application of electrical current to the brain while the patient is under the general anesthesia. It is indicated when rapid response is needed. Next is a mania in severe or life-threatening. Patient does not respond to the medication unless severe psychotic is present. ACT is usually considered when rapid improvement is needed, when medication are ineffective, or when severe psychotic is present. ACT works by altering brain chemistry and neurotransmitter activity. During the procedure, a controlled electrical stimulus induces a therapeutic seizure, which helps regulate brain function and stabilize mood. The procedure is performed in uncontrolled hospital environment using anesthesia and muscle relaxant to ensure the patient's safety. Now, let's proceed to the advantage and risk of ACT. ACT has a several advantages. It can produce rapid improvement, especially in severe cases of mania, and is effective when medication fail. However, there are also possible side effects including temporary memory loss, headache, and confusion. Despite these risks, SCT remain a safe and effective treatment when performed properly. Now let's proceed to the nursing management of ECT. The management of ECT involves coordinated effort to ensure the patient's safety and maximize the procedure effectiveness. The pre-procedure care. Before ECT is performed, several preparations are necessary. The patient must provide informed consent, ensuring that they understand the procedure, its benefit, and potential risks. The patient is also kept NPO or nothing by mouth to prevent aspiration during anesthesia. Baseline vital sign and medical assessment must also be completed before the procedure. Next, let's proceed to the procedure. During the procedure, the patient receives general anesthesia and muscle relaxant to prevent injury. Healthcare providers continuously monitor the patient's heart rate, blood pressure, and oxygen level. A controlled electrical current is then applied to induce the therapeutic seizure. Now let's proceed to the post-procedure care. After the procedure, the patient is closely monitored during recovery. Healthcare provider assess airway patency and vital sign until the patient regains full consciousness. Patient may experience temporary confuse, so they are carefully oriented and monitored for safety. Monitor side effects such as headache or muscle soreness and also manage. Now let's proceed to the summary of ECT. Electroconvulsive therapy is a safe and effective non-pharmacologic treatment used to severe or treatment-resistant in psychiatric condition. It works by producing a controlled seizure under general anesthesia to help stabilize mood. ECT is especially useful when a rapid improvement is needed or when medication are ineffectiveness. Healthcare providers play a major role in first, ensuring the patient's safety during the procedure, second, monitoring for side effects, and last, providing patient and family education. That's all. Thank you.